Hi, I'm Dr. Cassy Sims reporting live from Philadelphia at ACR22, and today we're going to talk about the change in reproductive rights in women's health in terms of rheumatology. So I'm going to be reporting on abstract number 0950. This is the impact of COVID-19 on pregnancy outcomes in women with rheumatic disease. So this is from the COVID-19 Global Rheumatology Alliance, which looked at data from 2020 to 2022. So we know that women with rheumatic disease have higher risk for poor pregnancy outcomes, things like preeclampsia, preterm birth, and pregnancy loss. So the question in this abstract in this study was, how does COVID-19 infection impact that? And did vaccination status make a difference? So in all of our clinic visits with patients, we're always encouraging them to get mRNA vaccinations and boosters, especially in our pregnant women. So this goes along with flu vaccinations as well. So we want to make sure that our pregnant women are vaccinated against all of these infections in order to mitigate and decrease poor pregnancy outcomes. So in this study specifically, there were 73 women who each had one pregnancy. Lupus and rheumatoid arthritis were the most common rheumatologic diagnoses. 70% of the women's diseases were in remission at the time of COVID infection, but unfortunately 60% of women were unvaccinated at that time. 90% of the pregnancies ended in a live birth, which is wonderful, but COVID-19 precipitated preterm delivery in 7% of unvaccinated women versus 4% of vaccinated women. So it seems to potentially make a difference in when a baby was delivered and maybe some pregnancy complications, with a little bit of an advantage for women who were vaccinated against COVID-19 prior to contracting it. So the bottom line here is that preterm birth was seen more commonly in unvaccinated women versus vaccinated women. So we need to make sure that our pregnant women become vaccinated against COVID-19 to decrease risks of poor pregnancy outcomes. Follow me at Dr. Cassy Sims on Twitter for additional coverage of ACR22.